Good morning and welcome. My name is Jacqueline Rodríguez from the Bipartisan Policy Center in Washington, D.C. We are thrilled for today's conversation with Politico to discuss the challenges facing millions of working families without access to paid leave, especially during the COVID-19 crisis. Since our founding, BPC has developed bipartisan solutions to critical public policy challenges. 2 years ago, we launched the Paid Family Leave Task Force led by former Small Business Administrator Maria Contreras-Sweet and former Senators Rick Santorum and Chris Dodd to build bipartisan support for a national paid family leave program. We recently conducted a national survey of likely voters to better understand their economic challenges during these unprecedented times. Our survey shows that working families overwhelmingly want Congress to enact pragmatic policies like paid family leave that help them stay connected to the workforce. But before turning to what promises to be a great conversation with today's speakers, I want to share some background on the current state of paid leave in the U.S. Prior to the pandemic, nearly 1/4 of American workers did not have a single day of paid sick time, and an astounding 81% did not have access to paid family leave. These rates were even higher among young, Black, and Latino Americans. One really worrying survey recently found that 1 in 10 essential workers will go to work even if they feel sick because they can't afford to miss a single paycheck. The pandemic is also causing caregiving demands to skyrocket. Today, 40% of workers have children at home. School closures are forcing families to pay for alternative childcare or leave the workforce altogether. And caregiving isn't just about kids. Workers who care for an adult dependent or an aging loved one are also struggling during this time. The good news is, there's growing bipartisan interest in finding solutions. In December, before the COVID-19 crisis, Congress enacted 12 weeks of paid parental leave for federal workers. And when the pandemic hit, Congress wisely included temporary paid sick and family leave in the Families First Act. However, these measures are not enough. The emergency leave programs only reach about 25% of the workforce. As a result, too many working families continue to face impossible decisions on how to balance work, family, and their own health. BPC believes Congress should expand the emergency programs in 3 ways. First, Congress should apply the paid leave requirements to big companies. Second, Congress should expand paid leave to new parents and those caring for adult dependents. And finally, Congress should authorize a 6-month extension to cover a potential second wave of the virus. If implemented, these changes would allow sick workers to recover more quickly and reduce community spread of the virus. Expanding temporary paid leave could also save money and keep workers attached to the workforce. On average, it costs $4,000 less for a worker to take 12 weeks of paid leave than collect 12 weeks of unemployment insurance. In the long term, we hope the next Congress and administration will take the lessons of 2020 to create a national paid leave program that benefits workers, keeps the public safe, and helps businesses remain competitive. With that, I turn things over to Politico's Megan Casella for today's discussion. Thank you.